Imaging alternatives to colonoscopy, CT colonography and colon capsule, ESGE and ESGAR Guideline, Update 2020. Introduction. Colorectal cancer represents a major cause of cancer-related morbidity and mortality in European countries. Colonoscopy has a pivotal role in early diagnosis and colorectal cancer prevention because of its high accuracy for detection of precancerous lesions, as well as the possibility to remove them. Despite incremental technical improvement, colonoscopy is still incomplete in a proportion of patients due to patient and/or endoscopist-related factors. Furthermore, patients may be reluctant to undergo a procedure, namely colonoscopy, that is still perceived as painful, despite the availability of sedation or anesthesia. Computed tomographic colonography, CTC, and colon capsule endoscopy, CCE, have been proposed as alternative imaging modalities to explore the colonic mucosa. CTC is a non-invasive imaging method that uses computed tomography for data acquisition combined with specialized imaging software to examine the colon. CCE, introduced several years later, is a painless and radiation-free alternative for the study of the entire colon, in which an ingestible wireless disposable capsule is used to explore the colon without sedation or gas insufflation. In this document, the European Society of Gastrointestinal Endoscopy, ESGE, and the European Society of Gastrointestinal and Abdominal Radiology, ESGAR, have updated the previously published guidelines on CTC and CCE and incorporated new evidence. Main recommendations, selection. ESGE and ESGAR recommend computed tomographic colonography, CTC, as the radiological examination of choice for the diagnosis of colorectal neoplasia. Strong recommendation, high-quality evidence. ESGE and ESGAR do not recommend barium enema in this setting. Strong recommendation, high-quality evidence. ESGE and ESGAR recommend CTC, preferably the same or next day if colonoscopy is incomplete. The timing depends on an interdisciplinary decision including endoscopic and radiological factors. Strong recommendation, low-quality evidence. ESGE and ESGAR suggest that, in centers with expertise in and availability of colon capsule endoscopy, CCE preferably the same or the next day may be considered if colonoscopy is incomplete. Weak recommendation, low-quality evidence. When colonoscopy is contraindicated or not possible, ESGE and ESGAR recommend CTC as an acceptable and equally sensitive alternative for patients with alarm symptoms. Strong recommendation, high-quality evidence. Because of lack of direct evidence, ESGE and ESGAR do not recommend CCE in this situation. Very low-quality evidence. ESGE and ESGAR recommend CTC as an acceptable alternative to colonoscopy for patients with non-alarm symptoms. Strong recommendation, high-quality evidence. In centers with availability, ESGE and ESGAR suggest that CCE may be considered in patients with non-alarm symptoms. Weak recommendation, low-quality evidence. Where there is no organized fecal immunochemical test, FIT-based population colorectal screening program, ESGE and ESGAR recommend CTC as an option for colorectal cancer screening, providing the screenee is adequately informed about test characteristics, benefits, and risks, and depending on local service and patient-related factors. Strong recommendation, high-quality evidence. ESGE and ESGAR do not suggest CCE as a first-line screening test for colorectal cancer. Weak recommendation, low-quality evidence. ESGE and ESGAR recommend CTC in the case of a positive fecal occult blood test, FOBT, or FIT with incomplete or unfeasible colonoscopy within organized population screening programs. Strong recommendation, moderate quality evidence. ESGE and ESGAR also suggest the use of CCE in this setting based on availability. Weak recommendation, moderate quality evidence.